through some red tape when it comes to your health care. That is what House Bill 1013 is aiming to do by allowing nurse practitioners to reach and treat even more Oklahomans. And you may not know this, but receiving care from a nurse practitioner comes with a pretty hefty fee that they have to pay, and they say it's unnecessary. So joining us now to talk about that price tag and piece of legislation is Tony Pratt-Reed, president of the Association of Oklahoma Nurse Practitioners. Thank you so much for being with us here this morning.
Thank you. It's my pleasure to be here.
Let's first get to this. What exactly is this fee that nurse practitioners are having to pay?
Nurse practitioners have a collaborative agreement, which is a supervising agreement with the Board of Nursing, and in order to get a physician to agree to that, oftentimes they charge us a monthly fee or an annual fee, and sometimes those are pretty hefty for us.
Can you share how much a fee, what that looks like for you guys?
Somewhere between $3,000 up to $8,000 a month.
$3,000 to $8,000 a month.
A month.
And which physicians are you paying? Is this, a one-time fee for one physician? Is this every time you see a patient?
No, this is an agreement that is signed by the physician and the practitioner, and it goes to the Board of Nursing. And it is a collaborative agreement, and it is renewed every 2 years as we renew our license. And so this is oftentimes a monthly fee that the physician requires in order to be a collaborative provider for us.
Okay. And so it's a collaboration fee for higher up physicians, but you're saying a lot of times there's not even teamwork with those physicians. Is that why you're saying this is unnecessary?
Well, that is correct. We in the state of Oklahoma have independent practice for diagnosing, treating, seeing patients. It only comes into play when we write a prescription. But the important thing to recognize is the fact that we're not asking them if this prescription is right each time. We're not asking them to review our charts to see if this was the right diagnosis for the patient. We write the prescription, we send it to the pharmacy, the patient picks it up, and the treatment plan is completed. And so it's an agreement that is an unnecessary regulation in our view with the Board of Nursing, and we want to remove that so that we can practice and treat these patients as we have been in our practices now.
And with this fee that you're talking about here, you pay that to the physicians. Does that in turn show up on, if I'm your patient, does that in turn show up on my bill? Is the patient in turn paying for that expense?
Good question. No, we bill insurance just like anybody else would bill the insurance. And so that isn't something that we get to pass on to the patients at all.
We're talking about this expense that you have to pay. Tell us more why the patient should care about House Bill 1013 passing.
The importance of that really is the fact that we are looking for better access to our patients. With the elimination of that expense to us, we can get out into the rural areas. We can get out and see more patients. We have the ability as providers to hire more practitioners in our practice so that we can use that money to pay for their fees and salaries and just better access for the patients.
And if you could give us in terms of numbers, how many people right now might be seeing nurse practitioners, and if this were to pass come the next legislative session, how many more people could actually be reached and receive care?
Well, that's a really good question. I don't know how many patients are seen by nurse practitioners. I know there's probably close to 3,000 of us, and most of us have really busy practices and are responsible for a fair load of our patients. I don't know numbers. I'm sorry about that.
No, that's totally fine. Another question I have before we had to break, who enacted this in the first place, this practice of paying a physician? Was that from physicians? Is that a government mandate? Where did this start?
I believe it is not a mandate. And some practitioners have agreements with physicians where there is no money that is exchanged for that. I believe that probably comes in our need to find a provider, and so we pay them for the service of being our collaborative